At this Quebec hospital, officials say 4 people have been treated for serious infections in a 10-day span, all linked to the same bacteria, group A streptococcus.
It's actually a very prevalent bacteria. In other words, it's very common in the community, and it's actually quite transmissible.
Strep A is typically known for causing milder illnesses like scarlet fever and strep throat. But when bacteria enter the blood or deep tissue, it can lead to flesh-eating disease, toxic shock syndrome, even rapid death.
They're continuing to come in at a steady pace.
A different pediatric hospital in Montreal is also seeing more serious strep infections. This physician says kids who didn't encounter the bacteria during the COVID pandemic are catching it now, alongside viruses like influenza that also came roaring back.
And what usually happens is a few weeks after that flu or influenza or other virus, that's when that strep that might be there in the throat becomes invasive.
Province-wide, Quebec recently saw a 56% increase in invasive strep A, compared to the average number of infections during the same time period before the pandemic. Ontario's strep season also involves a higher incidence rate across all age groups than pre-pandemic levels, and other countries like the US and UK reported spikes as well.
I will say it's actually a global phenomenon. This is not just a North American thing or, this part of Ontario. This is actually global.
All while a key antibiotic for early cases of strep remains in short supply. Health Canada has been reporting a shortage of amoxicillin since mid-November, but that won't hamper treatment of the more serious cases.
When somebody has an invasive infection, they're not getting amoxicillin typically to treat it. It's other antibiotics that we would use.
Okay, Lauren, you heard from Health Canada. They're addressing this shortage and working with drug makers. But what can Canadians do if they worry about a strep infection getting serious?
Right, so we heard from doctors you should be looking for some key warning signs, things like fever, headaches, confusion. If you start to feel that way, you should consider getting this checked out. I should note, though, that these serious infections are far more rare. Usually strep is just a common bacteria, mild illness. Many people don't even know they have it.
All right, Lauren Pelly, thank you.
Thank you.